before phase 3 trials are complete. Is that safe? Joining us now is Dr. Ashish Jha. He's the director of the Harvard Global Health Institute. So, Dr. Jha, great to have you here. I know ideally, of course, you would want to continue to complete phase 3 of the trials, but it sounds like Dr. Hahn, the head of the FDA, is saying that the benefit of getting it out on emergency use outweighs the complete safety of completing phase 3. What do you think of that?
Yeah, good morning, and thank you for having me on. So I think first and foremost, we all want a vaccine out as quickly as possible. The issue really is how to weigh the benefits and the risks. And emergency use authorization is allowed when the benefits outweigh the risks. And you can understand that when you're taking care of sick people, you might have a therapy that's not fully proven, but the benefits seem to be stronger. That makes sense. If you're going to give it to millions of people who are otherwise healthy, you have to have a much higher bar. And so what I would like to see is really robust data, ideally a full review, before we go ahead and authorize any kind of a vaccine.
As we sit here this morning, Dr. Jha, what questions do you have about the possible political influence at play with the FDA based on what we saw with the convalescent plasma and based on what we're seeing now with this data?
Yeah, so the good news is that the scientists at the FDA really are some of the leading scientists in the world. And if we let them drive the decision making, I will feel much more comfortable with whatever conclusion they come up with, as long as it's transparent and open. The problem is both with hydroxychloroquine and with the convalescent plasma. We saw a real politicization of that scientific debate in a way that I think has all of us concerned. So what I'd like is for the scientists to drive this decision, for it to be very transparent, and for political leaders to not get involved in deciding when a medicine or a vaccine is safe or not.
Let's just take a look at where the new cases are in the country right now. It's just interesting to get a status report as we begin this week. So as you can see, in terms of new cases, we have a graphic. It peaked at the end of June there, or I guess mid-July, and now the arc is coming down, but slowly. What do you see here?
Yeah, so as a nation, we are clearly doing better now on the last day of August than we were on the first day of August. Cases have come down. Deaths are starting to decline. Hospitalizations are down. This is good news, and it's largely because of smart policies in Texas and Arizona and Florida around masking and closing bars. So I see that as good news. But there's still parts of the country where things are both bad and even getting worse. In the Dakotas, in Kansas, and other states, we still see a lot of cases. And as a nation, we're still seeing a lot of cases of coronavirus. So progress, but we have a long way to go.
I'm very interested in what's going on college campuses right now, because I think it's 8,700 cases in 36 states now at colleges that have opened up, 1,200 cases at the University of Alabama alone. My question, Dr. Jha, is there's part of this which to me is reminiscent of what we saw in June with younger people, and by that I mean people in their 20s and 30s, going out to bars. Now you have people even a little bit younger than that, but basically, young people in their late teens or early 20s congregating at schools, and they're getting coronavirus. So what's to keep this from being the next spark that causes a wider outbreak?
Yeah, no, it's a very good question, and a couple of thoughts. I mean, first of all, I am concerned about what we're seeing across the country, and we do need to have young people behave a bit more responsibly, and we need less misinformation directed towards them that somehow this is safe or not an important disease. But the second part, which I think is even more important, is that a lot of colleges are not taking this seriously. They've brought kids back, they've brought students back. They haven't done entry testing, they haven't done quarantining, they don't have a surveillance program. And they're just sort of crossing their fingers and hoping for the best. And that's not a strategy. So I really put a lot of the responsibility here on college and university leaders. They have to do better.
And they're not islands. I mean, these colleges aren't islands. Oftentimes they're in cities,
Exactly.
They're in towns, there are a lot of people near them. All right, Dr. Jha, we appreciate it. Thank you very much.
Thank you.